What is metastatic breast cancer? When breast cancer spreads, or metastasizes, to other parts of the body, it normally moves to one or more of the following areas: bones, lungs, liver, brain. Only rarely does it spread to the colon. Slightly more than 12 out of every 100 women will get breast cancer in their lifetime. Of these cases, research estimates about 20 to 30% will become metastatic. If the cancer metastasizes, treatment becomes focused on preserving your quality of life and slowing the spread of the disease. There isn't a cure for metastatic breast cancer yet, but medical advancements are helping people live longer lives. Symptoms of metastasis to the colon. Symptoms associated with breast cancer that spread to the colon include nausea, vomiting, cramping, pain, diarrhea, changes in the stool, bloating, abdominal swelling, a loss of appetite. Review of cases treated at the Mayo Clinic also found that 26% of women who had colon metastases experienced blockage of the intestine. It's worth noting that in the review, colon metastases are broken down to cover 8 other sites, including the stomach, esophagus, small bowel, rectum. In other words, this percentage is covering more than just women with metastasis in the colon. What causes metastasis? Breast cancer usually starts in the cells of the lobules, which are glands that produce milk. It can also start in the ducts that carry milk to the nipple. If the cancer stays in these areas, it's considered non-invasive. If breast cancer cells break off the original tumor and travel via blood or the lymphatic system to another part of your body, it's referred to as metastatic breast cancer. When breast cancer cells travel to the lungs or bones and form tumors there, these new tumors are still made of breast cancer cells. These tumors or groups of cells are considered breast cancer metastases and not lung cancer or bone cancer. Almost all types of cancer have the potential to spread anywhere in the body. Still, most follow certain pathways to specific organs. It's not fully understood why this happens. Breast cancer can spread to the colon, but it's not likely to do so. It's even uncommon for it to spread to the digestive tract. When this does happen, cancer is more often found in the peritoneal tissue that lines the abdominal cavity, stomach, or small intestine instead of the large intestine, which includes the colon. A study trusted source of people who had breast cancer metastases lists the sites breast cancer is most likely to spread to first. This study also lists the top 4 locations for breast cancer to spread: to the bone 41.1% of the time, to the lung 22.4% of the time, to the liver 7.3% of the time, to the brain 7.3% of the time. Colon metastases are so uncommon that they don't make the list. When breast cancer spreads to the colon, it usually does so as invasive lobular carcinoma. This is a type of cancer that originates in the milk-producing lobes of the breast. Diagnosing metastasis to the colon: if you're experiencing any of these symptoms, especially if you've previously received a breast cancer diagnosis, speak with your doctor. The doctor may order 1 or more tests to determine whether cancer has spread to your colon. When examining your colon, your doctor will look for polyps. Polyps are small growths of abnormal tissue that can form in the colon. Although most of them are harmless, polyps can become cancerous. When you have a colonoscopy or sigmoidoscopy, your doctor will snip off any polyps they find. These polyps will then be tested for cancer. If cancer is found, this testing will show whether the cancer is breast cancer that spread to the colon or if it's a new cancer that originated in the colon. Colonoscopy. A colonoscopy is a test that allows your doctor to look at the inner lining of your large intestine, which includes the rectum and colon. They use a thin, flexible tube with a tiny camera on the end called a colonoscope. This tube is inserted into your anus and up through your colon. A colonoscopy helps your doctor find ulcers, colon polyps, tumors, inflammation areas that are bleeding. The camera then sends images to a video screen, which will enable your doctor to make a diagnosis. Normally, you'll be given medication to help you sleep through the exam. Flexible sigmoidoscopy. A flexible sigmoidoscopy is similar to a colonoscopy, but the tube for a sigmoidoscopy is shorter than a colonoscope. Only the rectum and lower part of the colon are examined. Medication usually isn't needed for this examination. CT colonoscopy, sometimes called a virtual colonoscopy. A CT colonoscopy uses sophisticated X-ray technology to take two-dimensional images of your colon. This is a painless, non-invasive procedure. Treating metastatic breast cancer. If you receive a diagnosis of breast cancer that's spread to your colon, your doctor will likely order additional tests to see whether the cancer has spread to other parts of your body. Once you know exactly what's going on, you and your doctor can discuss the best options for treatment. This may include one or more of the following therapies. Chemotherapy. Chemotherapy drugs kill cells, especially cancer cells, that are dividing and reproducing quickly. Common side effects of chemotherapy include hair loss, sores in the mouth, fatigue, and nausea, vomiting. Increased risk of infection. Every person responds differently to chemotherapy. For many, the side effects of chemotherapy can be very manageable. Hormone therapy. Most breast cancers that have spread to the colon are estrogen receptor positive. This means the growth of breast cancer cells is triggered at least in part by the hormone estrogen. Hormone therapy either reduces the amount of estrogen in the body or prevents estrogen from binding to the breast cancer cells and promoting their growth. Hormone therapy is more often used to reduce further spread of the cancer cells after initial treatment with chemotherapy, surgery, or radiation. The more severe side effects that people may have with chemotherapy rarely occur with hormone therapy. The side effects of hormone therapy may include fatigue, insomnia, hot flashes, vaginal dryness, mood change, blood clots, bone thinning. In premenopausal women, increased risk of uterine cancer. For postmenopausal women, targeted therapy, often called molecular therapy, uses drugs that block the growth of cancer cells. It normally has fewer side effects than chemotherapy, but the side effects may include rashes and other skin problems, high blood pressure, bruising, bleeding. Some drugs used in targeted therapy can damage the heart, interfere with the body's immune system, or cause serious damage to parts of the body. Your doctor will monitor you to avoid any complications. Surgery may be performed to remove bowel obstructions or portions of the colon that are cancerous. Radiation therapy. If you have bleeding from the bowel, radiation therapy may treat it. Radiation therapy uses X-rays, gamma rays, or charged particles to shrink tumors and kill cancer cells. Side effects may include skin changes at the site of the radiation, nausea, diarrhea, increased urination, fatigue. What's the outlook for people with metastatic breast cancer? Although cancer that's metastasized can't be cured, advancements in medicine are helping people with metastatic breast cancer lead longer lives. These advances are also improving the quality of life for people living with the disease. According to the American Cancer Society, people with metastatic breast cancer have a 27% chance of living at least 5 years after their diagnosis. It's important to remember that this is a general figure. It doesn't account for your individual circumstances. Your doctor can provide you with the most accurate outlook based on your individual diagnosis, medical history, and treatment plan.